today is HPLC in hemoglobinopathies, and HbA1C has been allotted by you all. So HPLC basically means high pressure liquid chromatography or high performance. You can use both the words, high pressure or high performance liquid chromatography. It's a very important and a very interesting tool which is used very widely in not only in biochemistry laboratory but in biotechnology, pharmaceutical industry, many industries. So before we go ahead with HPLC, first of all, I would like to understand from your end, do you have any background about of chromatography? I assume you must have done some practical experiment on chromatography during your PG days of 3 years. Is it so? Has anyone worked on chromatography?
So we all
Especially
have to do paper chromatography for
yes,
every exam.
yes, correct. So basically, paper chromatography is that core technique which you are dealing with. If I trace back the history of chromatography, it was a Russian scientist named Sweat uh, who came up with this idea of chromatography in the year 1901, around 1901 or 1902. So what he did was he took a glass tube or a glass cylinder and he added chalk in it, basically calcium carbonate, and he took uh, plant extracts, basically leaves of different color, so that is chlorophyll. So he churned all the leaves of different color and he mixed it in a solvent and he added in that column. And what he saw was that mixture was separated into different colors. So that is how the name chromatography came up. Chrome means color, graphy is basically writing. Okay. So it's nothing but chromatography is nothing but it's a technique for separation. So whenever a question comes into your mind that I have a mixture which has n number of components in it and I want to separate it out, I want to uh, separate out individual components, then the first answer which should come to your mind is chromatography. Okay, so if you have to define it, it's nothing but it separates compounds dissolved in a liquid sample and allows qualitative and quantitative analysis of what components and how much of each component are contained in a sample. So if you have a mixture containing three different components, chromatography will help you to separate out those three different components and will also help you identify what that component is and will also help you quantify that component individually. So the devices which are dedicated for such kind of separation is a column. You might have commonly heard about this word column. Then you have a pump, which actually delivers the solvent at a stable flow rate. These are some key components of an HPLC: a column, a pump, a solvent. I'll get into the details in the further slides. So if you have a look at it, it's a very crude, a very core schematic diagram which I've made out here. You know, in that bottle out there, what you can see, this is the mobile phase, okay, which is nothing but the solvent. Then you have a pump out here. Then you have the sample which is a mixture of components and you are looking to separate it out. Then you have a column. Then you have a detector. So the two important words which you need to remember when you are dealing with chromatography is a mobile phase and a stationary phase. Most important words. So stationary phase is something which you can see out here. It is packed in a column. And mobile phase, what you can see out here is a solvent. So it basically takes your sample or the component mixture, passes through the column or the stationary phase, and the separation takes place, and in the detector you can read it. Now, what is the use of a pump? Pump actually delivers that mobile phase to the stationary phase at a flow rate. And you can define that flow rate. So if you want to deliver the mobile phase at 1 ml per minute, it is your pump which will help you to deliver it at 1 ml per minute. If you want to deliver it at 2 ml per minute, the pump would help you to do that. Okay. Now, what are the types of HPLC techniques? First of all, you can have different types of HPLC techniques based on the modes of chromatography. These are the words which you might have come across: normal phase and reverse phase. Are you all there with me?
Yes,
Yeah,
sir.
Galit. Okay.
Yes, sir.
Yes,
Yeah,
sir.
yeah. So, based on the modes of chromatography, you have normal phase and reverse phase. Now, the game is all with the mobile phase and the stationary phase. Okay. So, what happens in normal phases? In normal phase chromatography, your mobile phase is polar. I'm sorry, your stationary phase is polar and your mobile phase is non-polar. Okay, just try to understand that. In a normal phase chromatography, your stationary phase will be polar and your mobile phase will be non-polar. So basically वो stationary phase या column में क्या लगा रहेगा, ये जो पीछे आपको column दिख रहा है, ये column में क्या लगा रहेगा, तो कुछ पोलर कंपाउंड यानी सिलिका, एल्यूमिना, वो जेल वैसे लगा रहेगा आपका. ओके, और ये जो आपका मोबाइल फेज है ये नॉन पोलर रहेगा. सो यहाँ पे सेपरेशन कैसे हो गया, जो आपका कंपोनेंट मिक्सचर है, the component mixture would have components which have affinity, which have liking towards polar a polar surface, and some would be having a liking towards a non-polar surface. तो जिनकी affinity polarity polar surface की ओर है वो stationary phase को चिपक जाएंगे, और जो non-polar है वो mobile phase में ऐसे ही रहेंगे. So that is how the separation is taking place. So the non-polar would come out first and the polar would remain behind. रिवर्स फेज में एग्जैक्टली ऑपोजिट होता है. रिवर्स फेज में योर स्टेशनरी फेज इज नॉन पोलर. सो द कॉमनेस्ट नॉन पोलर स्टेशनरी फेजेस आर अ C18 column or a C8 column. C is the carbon, okay? C18 column or C8 columns which are used in daily practice in the laboratory. And your mobile phase is polar. So here you would have water, methanol, acetonitrile. These are the commonly used solvents in the mobile phase in reverse phase chromatography. जो normally routine laboratories या industry में चलता है वो है reverse phase chromatography. That is the one which is commonly used. Here, as I mentioned, the stationary phase is a non-polar C18 or C8, and the mobile phase is polar. So, for example, let's take a component mixture. You have two analytes in your sample which you want to separate. So one of the analyte may be non-polar. So what will it happen? It will go and stick to the stationary phase. And one of your analyte would be polar. It would remain in your solvent, that is your acetonitrile water or methanol, and move out along with it. Okay, so that is how the separation is taking place. तो क्या हुआ? Polar components or polar compounds पहले बाहर आ गए और non-polar बाद में बाहर आ गए. ठीक है, और याद रखना, the bond which is being formed between मतलब the molecule or the analyte which is sticking to your stationary phase, it's not at all a covalent bond, it's not a permanent bond, it's usually van der Waals forces or van der Waals interaction or hydrogen bonding which is there. So basically आप जब मोबाइल फेज का कॉन्सेंट्रेशन बदलोगे तो क्या होगा, वो जो एनालाइट या मॉलिक्यूल विच वाज स्टिकिंग टू द स्टेशनरी फेज वो ऑटोमेटिकली निकल जाएगा और आपके वापस मोबाइल फेज में आ जाएगा और निकल जाएगा. बिकॉज वी वांट सेपरेशन, मतलब हमें एनालाइट 1 और एनालाइट 2 को अलग करना है. सिर्फ एनालाइट 2 या एनालाइट 1 बाहर नहीं चाहिए, हमें दोनों बाहर चाहिए पर अलग अलग टाइम पे बाहर चाहिए, हमें उसे सेपरेट आउट करना है. ठीक है. Next is you can have different HPLC techniques based on the principle of separation. Now you have adsorption, partition, ion exchange, size exclusion and affinity. Now the first one is adsorption. नाम में ही लिखा है, आई थिंक सो मेरे पास आगे एक फोटोग्राफ भी, हाँ ये देखो रिवर्स फेज की फोटोग्राफी ठीक है. यू कैन सी द इमेज रिवर्स फेज क्रोमेटोग्राफी.
Yes, sir.
So you have the column stationary phase. ये देखिए मिक्सचर ऑफ कंपोनेंट्स अलग अलग है, ग्रीन कलर, ब्लू कलर, ऑरेंज कलर. यहाँ पे आपने मैंने मोबाइल फेज डाल दिया, which is a polar compound, water, acetonitrile or methanol. Now see what has happened. The most hydrophobic components interact with the column best. So जो components को पानी पसंद नहीं है, hydro water phobic fear. So the compounds or the molecules or the analytes which do not like water, they will go and stick to the column. And the least hydrophobic components elute first. समझ गया? जिनको पानी पसंद है वो पहले निकल गया. So from this diagram, what you can understand, the analyte or the component which is orange in color loves water the most. So it has not stayed back in the column. It has moved out. And the analyte which is blue in color hates water the most. So it sticks to the stationary phase and comes out last. Understood?
Yes, sir.
Okay. So adsorption में क्या होता है? The principle of adsorption. If you remember, absorption is permanent, adsorption is temporary. So imagine this column. So what happens? The analyte or the component mixture will get adsorbed on the stationary phase. The one which adsorbs the least comes out first, and the one which adsorbs the most comes out last. Okay, that is on the basis of adsorption. Next is partition. Partition में क्या होता है? Usually you're dealing with two immiscible liquids. So immiscible मतलब two liquids don't mix with each other. Okay, oil, water don't mix with each other. So यहाँ पे क्या होगा? Your mobile phase is also a liquid. Your stationary phase is also a liquid, but they both are immiscible. They don't mix with each other. Now, in this, when you add an analyte, when you add a mixture of components, so these components, depending upon their what do you call partition coefficient, थोड़ा complicated word है, but किसी को stationary phase वाला liquid पसंद होगा, किसी को mobile phase वाला liquid पसंद होगा. So basically, your analytes or your component mixtures are getting partitioned between two immiscible liquids. Understood? So the analyte which loves the liquid of the mobile phase comes out first, and the analyte which loves the liquid of the stationary phase comes out last. Okay, so that is your partition chromatography. Ion exchange or ion pair, नाम में लिखा है. The separation happens on the basis of net electric charge. Okay, so you have two types of ion exchange chromatography: cation exchange and anion exchange. And so I have a diagram to show you guys. Yeah, this one. So cation exchange में क्या होगा? Your stationary charge, stationary phase has a resin which has a positive charge in it. Okay, so when you add component mixture, आपके analyte जिसको negative charge है वो जाके stationary phase में चिपक जाएगा, और जिसको positive charge है वो नीचे आ जाएगा. So whenever things come out of a column, it's called elution. That technique, that process is called elution. Okay. So in cation exchange, as I said, the resin is having a positive charge. So your negatively charged ions would stay back, as you can see out here. See, you can see out here, they're staying back. And the positively charged ions are moving out, or they are eluting. The word is elution. And बाद में आप क्या करोगे? हमें ये negatively charged पीछे नहीं छोड़ना है. तो आप ये जो बफर डाल रहे हो या ये जो सॉल्वेंट डाल रहे हो उसका pH बदल दो. If you change the pH, or if you create a gradient, what will happen is this negatively charged ion will also come out of the resin and move out of the column and out. So that is ion exchange. So cation exchange में the stationary phase resin is positively charged, and in anion exchange chromatography the stationary phase resin is negatively charged. Okay, that is your ion exchange. Next is size exclusion or gel permeation. ये size exclusion chromatography देखो यहाँ पे. तो यहाँ पे क्या है, एक आपने ग्लास सिलेंडर लिया है, इसमें आपने बीड्स डाले, सिलिका के बीड्स बोलो या अगार के बीड्स बोलो. They are porous beads. Okay, so they individually have small pores also in it. So here the separation is basically happening on the basis of size exclusion or gel permeation. So here you have a sample which has analytes of different sizes. Here is your column which is packed with porous beads or agar beads, and now I have added the saline. So what will happen? The analyte, which is big in size, immediately passes down, because it doesn't have to pass through the porous bead. Basically it cannot enter the porous bead, because इसके जो pores है वो इतने बड़े size वाले molecule को अंदर ले ही नहीं सकते. If you see this yellow color molecule, big in size, cannot pass through this pore. Whereas छोटे जो है red color के है, they are small in size, they can pass through the pore. Okay, so the time taken for a big molecule to pass through this column is less, so it comes out fast. And the time taken for the small molecule to pass through this column is more, because it passes through all the pores of all the beads and then it will come out. Okay, so here you can see the peak. This is the blue molecule and this is the red molecule. ठीक है, तो ये हो गया आपका size exclusion और gel permeation. Then you have affinity. Affinity chromatography आपको ये slide पे दिख रही है. Affinity chromatography, basically what you're trying to use is you're exploiting the affinity of a particular molecule to its ligand or antigen antibody interaction, the strong affinities which exist in the nature. So for example, अभी ये देखिए, ये this is the column, a stationary phase which is having an affinity ligand to it. So now when you add a sample which has mixture in it along with the buffer, what will happen? The green color analyte is having strong affinity for this ligand, so it will stick to it. And the blue color analyte does not have any affinity to the ligand, it just moves up. Okay, so that is affinity. So basically we are exploiting the principle of affinity of an analyte to its ligand. The classical example would be antigen antibody reaction. Then based on the elution technique, you can have isocratic elution or you can have gradient elution. As I mentioned initially, gradient आपका जो मोबाइल फेज है, आपका जो सॉल्वेंट है, उसका पीएच का एक ग्रेडियंट बना दो, तो उसके हिसाब से आपके एनालाइट्स अलग अलग इंटरवल पे, अलग अलग लेवल पे इल्यूट होते जाएंगे. Based on scale of operation, analytical, preparative, that means analytical, from the name itself you understand analytical is you want to analyze the components in the mixture, you want to understand, you want to know what analytes are present in the mixture and you want to quantify them. Preparative matlab sometimes before basically this comes into the picture when we are dealing with an LC and an MS, liquid chromatography, mass spectrometry. So before we want to push any analyte into the mass spectrometer, you want to prepare it. So आप LC में उसका separation करोगे, उसको prepare करोगे और फिर उसको MS में डालोगे. That is preparative. Okay. So these were the different types of HPLC techniques and on the basis of which on which they have been divided. A flow diagram. So as I mentioned, HPLC is around high pressure or high performance liquid chromatography. The pressure is around, if I'm not wrong, it's around 400 to 600 bars. So इसमें basically क्या हो रहा है? ये आपका detailed flow structure है. ये आ गया mobile phase. Yeah, most important is a degassing unit. So basically in the any gas is not supposed to be entering the column phase because it affects your interpretation in the end. You have a pump, as I mentioned, to maintain a constant flow of the mobile phase. Then you have a sample which an injector, basically this is the injector, it injects the sample whose analytes you want to separate. Then you have a column which has been maintained at a constant temperature. Then you have a detector and then you have a workstation. So this is the basic flow diagram of an HPLC. The best example of HPLC in community, if you might be knowing, is you might have heard of Biorad D10. आपने सुना है? So yes, Biorad D10, variant 2 turbo, all these are based on the principles of HPLC. Okay.
We have Biorad variant 2 in science.
Variant 2 turbo है आपके, variant 2 है आपके पास?
जी.
Yes. Some people use dual D10. So variant 2 you're doing HbA1C or hemoglobinopathies?
Hemoglobinopathies, sir.
Okay, hemoglobinopathies. So you would be knowing it better. So I think so I have covered this space. So I wouldn't go into detail of this. I'll go to the next slide. So you might have seen this chromatogram. So a chromatogram में आपको x axis पे है time, y axis पे है detector signal intensity. You will normally see a baseline out here. Then you will see a peak. The peak is that compound which has eluted out. So the most important concept which you need to know out here is the retention time. आपको TR दिख रहा है retention time. तो जब से आपका सैंपल इंजेक्ट किया या कॉलम में गया और जब वो बाहर आया, मतलब कितने टाइम तक वो रिटेन्ड था अंदर कॉलम में, दैट्स द रिटेंशन टाइम. तो जो कंपाउंड सबसे पहले बाहर निकला है उसका रिटेंशन टाइम कम रहेगा मेटाबॉलिज्म, और जो बाद में बाहर निकला है उसका रिटेंशन टाइम ज्यादा रहेगा. एंड द एरिया अंडर द कर्व ऑफ दिस पर्टिकुलर पीक इज यूजुअली द कॉन्सेंट्रेशन. दिस इज द पीक एरिया एंड द पीक हाइट. So area under the curve is usually the concentration of that analyte. What is the application of HPLC? It is used for separation. Most important word is separation. HPLC का main core फंडा है separation. जब भी आपको कोई भी डाउट होगा, मुझे component mixture को separate करना है, answer is chromatography. So it is separation, identification and quantification of amino acids, proteins, nucleic acids, hydrocarbons, carbohydrates, lipids, pharmaceuticals, pesticides, pigments, मतलब unending है. मैं जितना बोलूँ ये तो खाली 7-8 नाम मैंने लिखा है, but it is unending. You can go on and on and on. Coming to the topic, that is use of HPLC in HbA1c. Okay, so the institute which is using a variant 2 turbo for hemoglobinopathy, what are you doing for A1C?
So we don't give we don't do HbA1c for patients, sir.
Okay, okay. So this hemoglobinopathy is for patients or it's some project?
It's for patients, antenatal care.
Sorry,
ANC,
which
and
one?
we have ANC OPD patients, and we have also expanded it to other departments also.
Acha, acha. Okay, okay. So good. Then I've taken HbA1c first and then hemoglobinopathies, because I think so. A1c is the application which is commonly used nowadays. Hemoglobinopathy, only selected institutes would be using it. So now,
Because if we start
glycated
giving
hemoglobin.
HbA1c, the load will be too much.
Yeah, very
We
true.
needed a lot of samples for that.
Ha, ha, ha. So what are the method you are using for estimation of HbA1c in your laboratory then?
HbA1c we don't do for patients.
You know, acha,
They
theek
have to
hai.
get it done from outside.
You're getting it done from outside.
Yes, sir.
So Biorad is having this machine called D10 or Dual, where D10 basically is dedicated for HbA1c, D10, D100. They are testing systems for HbA1c. Dual is also one of the model which you can do both HbA1c as well as hemoglobin separations, hemoglobinopathies identification. So let's first discuss glycated hemoglobin. So we know what is glycated hemoglobin. It is an irreversible, non-enzymatic attachment of a sugar residue to one or both N-terminal valine of hemoglobin beta chain. Okay. So N-terminal valine of hemoglobin beta chain. That is what you have to remember. उसपे ये sugar residue लगता है. Now, what is a normal? What does the normal adult hemoglobin comprise of? You have HbA0 or HbA, which is the adult hemoglobin, 2 alpha chains, 2 beta chains, HbA2, 2 alpha, 2 delta, and HbF, 2 alpha, 2 gamma. I think so everyone must be well versed with this. Now, attachment, when a carbohydrate residue attaches to HbA, it forms HbA1. We have still not reached C. Okay. तो HbA समझा, अडल्ट हीमोग्लोबिन अल्फा टू बीटा टू. अभी जब बीटा टू पे कार्बोहाइड्रेट रेसिड्यू लगता है, कुछ भी हो सकता है, सिर्फ ग्लूकोज की बात नहीं कर रहा हूं, जब कार्बोहाइड्रेट रेसिड्यू लगता है तो HbA1A हो जाता है, HbA1. नाउ उसके सब टाइप्स देखिए. HbA1 we restrict ourselves to carbohydrate. So when the carbohydrate is fructose 1,6 diphosphate, it is HbA1 small a1. When it is glucose 6-phosphate, it is HbA1 small a2. When it is pyruvic acid, it is HbA1b. And when it is glucose, it is HbA1c, what we are talking about. Okay. So HbA1, A1, A2, B, and C. So HbA1c, it constitutes about 80% of HbA1. The number is quite significant. Basically, these different fractions of HbA1 can also be defined by their electrophoretic and chromatographic properties, which differ slightly from those of the major components of the adult hemoglobin. So what is the significance of estimating glycated hemoglobin? The most important being it reflects average plasma glucose over the previous 8 to 12 weeks. That is the lifespan of RBC. Okay. So your fasting NPP gives you the instant levels, fasting PP random. But how was your glucose control over the period of past 3 months, past 12 weeks, around 3 months? That idea you can get from glycated hemoglobin. It is nowadays also used as a diagnostic test for diabetes and a screening test for persons at high risk of diabetes. Preferred test for assessing the glycemic control in people with diabetes, prognostic marker for micro and macrovascular complications of diabetes. Basically, there are a number of papers which have been published where it serves as a very good prognostic marker to predict the micro and the macrovascular complications of diabetes. So you all, I think, you might be aware, less than 5.7% is normal. 5.7 to 6.4 would be pre-diabetic, and 6.5 and above is diabetic. What are the different methods of determining glycated hemoglobin? So one is what we are going to discuss today based on the charge differences. That is ion exchange HPLC. The other one is electrophoresis, and the third one is isoelectric focusing. And based on structural differences, you have affinity chromatography and immunoassay. Chemical methods nowadays rarely used. When I was a postgraduate student, that was the time when we actually did HbA1c by chemical methods. It's completely obsolete nowadays. So the Biorite D10 works on the ion exchange HPLC method. To be more specific, it is cation exchange HPLC. So these HPLCs which are running in the market giving you HbA1c test, is the principle is cation exchange HPLC. Here is a sample chromatogram. You need to understand how a chromatogram is to be interpreted. So many of you might have seen this chromatogram. X axis पे आपका retention time है, Y axis पे आपका intensity है, signal intensity. So most important one is the area. If you can see out here, number one is the total area. So total area मतलब ये पूरे chromatogram की area की बात कर रहे हैं हम लोग. So it should be around 1 million to 5 million. If the area is less, then you might have to run the sample in dilution. Then the A1C and the A0 peaks have to be currently identified. See, A1C, आप देखोगे retention time 0.78, तो ये आपकी A1C की peak है, जो violet color या purple color में दिख रही है, ये A1C की peak है, और ये जो बड़ी वाली peak दिख रही है, वो A0 है, the adult hemoglobin. Okay. So A1C and A0 peak should be correctly identified. Retention times of A1C and A0 peak should be consistently in the range as defined by the manufacturer. Then you have HbF, which HbF out here, it should be less than 10%. LA1C and CHbA. Now, what is LA1C? LA1C is nothing but it's labile A1C. So ये कब बनता है? Basically, labile A1C is nothing but Schiff's base. So when it's a very temporary stuff. It's not a permanent arrangement or a permanent bond between glucose and the beta globin chain. But एक क्या बोलते हैं intermediate step जो रहता है जब ग्लूकोज बीटा ग्लोबिन चेन को बाइंड हो रहा है, तब एक इंटरमीडिएट प्रोडक्ट बनता है, उसको शिफ्ट बेस बोलते हैं, लिबाइल A1C बोलते हैं. उसका परसेंटेज बहुत कम रहता है, लेस देन और इक्वल टू 4%. कार्बामाइलेटेड HB1 is कार्बामाइलेटेड is this carries significance. Basically what happens is cyanate gets attached to the globin chain of the hemoglobin and gives you a कार्बामाइलेटेड hemoglobin. Now when would cyanate get attached? Basically जब यूरिया लेवल्स बॉडी में बढ़ जाते हैं, when the urea level is very high, the breakdown product which you may get is cyanate, and which goes and binds to the globin chain, and that bond which is formed is an irreversible bond. It's a permanent bond, and that is carbamylated hemoglobin. So the concern usually arises when the patient is a CKD, not CKD, but an acute kidney failure hai, ya kidney is damaged, where probably the urea level is very high, uremia basically. तो आपका कार्बामाइलेटेड हीमोग्लोबिन बढ़ सकता है. Ideally, it should be less than or equal to 4%. HbA1c should be within reportable range. Baseline should be, this is the baseline, it should be properly constructed, and A1C peak should be sharp and symmetrical. तो अगर आपको याद रखना है, it's very simple. A1C और पहले आप देखो एरिया काउंट आपका सही है क्या, A0 पीक और A1C पीक बराबर है क्या, उसके बाद आपका F पीक लेस देन 10 होना चाहिए, बाकी कोई भी पीक लेस देन 5 होने चाहिए, और बेसलाइन सीधा होना चाहिए. So if all these are meeting your criteria, your chromatogram is good to report. So this is the acceptance criteria. Most of it I've already discussed. Total area, range, quality control. So for D10, the reportable range as per NGSP is 3.8 to 18.5%. इसके नीचे अगर कोई वैल्यू आई तो कायदे से आप रिपोर्ट नहीं कर सकते. 3.8 के नीचे आई और 18.5 के ऊपर गई तो भी आप रिपोर्ट नहीं कर पाओगे. आपको कोई दूसरा प्लेटफॉर्म यूज करना पड़ेगा टू रिपोर्ट HbA1c. HbF should be less than 10, labile A1C less than 4, कार्बामाइलेटेड. तो बेसिकली टू कीप थिंग्स सिंपल मैं क्या याद रखता हूँ, HbF less than 10, बाकी सारे A1C less than 5. That is how I remember. The chromatogram should not have any other windows. So if the patient is having any hemoglobin disorder, you might come across windows like variant window, S window, C window. So when you're running this dual or biorad machine in A1C mode, if the patient is having a hemoglobinopathy, you will get to see the peaks, but you wouldn't be able to identify which peak it is. आपको S विंडो C विंडो दिख जाएगा अगर पेशेंट को है तो, वेरिएंट विंडो दिख जाएगा अगर पेशेंट को है तो, बट आप बता नहीं पाओगे कि पेशेंट को कौन सा हीमोग्लोबिन डिसऑर्डर है. उसके लिए आपको वो दूसरा मोड यूज करना पड़ेगा, हीमोग्लोबिन मोड वाला. ठीक है. So if it is a trait condition, yani if the variant window S or C window are less than 50%, still it is possible to report HbA1c. But if the windows are more than 50%, that is a homozygous condition, then you cannot report HbA1c on this particular platform. Reference value मैंने already बोल दी है. From you might be aware about estimated average glucose या derived glucose. वो ये formula से बनता है. From HbA1c you can actually go for an estimated average glucose. Factors affecting HbA1c estimation, we are completely dealing with the RBC out here. Basically हम RBC को फोड़ रहे, we are lysing the RBC, taking the hemoglobin and finding the hemoglobin which has glucose attached to it. So obviously if the patient is having any kind of an RBC disorder, or if the patient is having any kind of a hemoglobin disorder, then your HbA1c estimation is going to get affected. And renal disease मैंने क्यों लिखा है? कार्बामाइलेटेड. तो अगर रीनल डिजीज होगा तो यूरिया बढ़ेगा, कार्बामाइलेटेड हीमोग्लोबिन भी बढ़ जाएगा, तो आपका A1C estimation affect होगा. So that was HPLC in A1C. Coming to HPLC in hemoglobinopathies. So principle remains the same because the analyzer is same. सब कुछ सेम रहेगा, खाली आपके बफर्स में थोड़े चेंज हो सकते हैं, बिकॉज बेसिकली आप क्या कर रहे हो, वहां पे A1C को सेपरेट करके आइडेंटिफाई कर रहे हो. यहाँ पे हीमोग्लोबिनोपैथीज में आप हीमोग्लोबिन के अलग अलग टाइप्स को सेपरेट करके आइडेंटिफाई कर रहे हो. ठीक है. तो आपका प्रिंसिपल वही है, कटायन एक्सचेंज HPLC. So here I prepared a small table because to talk about HPLC and hemoglobinopathies you may require another 3 to 4 lectures because हर एक का identification कभी easy हो सकता है, कभी challenging हो सकता है. But the most common ones which you can come across are these in front of you. So आपको पता है normally adult hemoglobin यानी A0 जो है, it occupies the maximum percentage, around 95% would be A0 only. Then you have A2 which is around 2 to 3.5%, and F would usually be less than 1%. This is a normal chromatogram for identifying different hemoglobin fractions. So adult hemoglobin around 95%, HbA2 around 2 to 3.5%, and HbF less than 1%. Now let's see the anomalies. So ये ग्राफ कुछ ऐसे, ये क्रोमेटोग्राम कुछ ऐसे दिखता है. These are some examples which I have shown out here. Okay, so आपको दिख रहे होंगे. So have a look at this. Now let's first see the F window, which is fetal hemoglobin. So approximate retention time 0.6 to 0.9 minutes. This could vary from different biorad systems. Your बायोरैट ड्यूअल का थोड़ा अलग रह सकता है, वेरिएंट का थोड़ा अलग रह सकता है, पर मोटा मोटा इसी में आएगा 0.6 to 0.9 minutes. So you have HbF. So if the cases of beta thalassemia major, then you would have HbF more than 70%, and hereditary persistence of fetal hemoglobin, HbF would be around 15 to 30%. Even in sickle cell disease, homozygous sickle cell, compensatory rise in HbF is seen. Then you have P2 and P3 windows. I mean, P2 window is basically H glycated hemoglobin. So that we have dealt separately in the previous slide. So I'll not go into that. That's glycated hemoglobin. P3 window is very interesting. P3 window is something which you would see even in the chromatogram of HbA1c. P3 window आपको यहाँ पे दिखा होगा. ये देखो P3 window. P3 window usually indicates degraded hemoglobin. So अगर आपको identify करना है कि आपका सैंपल खराब है, काफी दिन तक स्टोर किया हुआ है, यूजुअली ईडीटीए सैंपल आपको आंखों को देख के भी समझ में आ जाएगा. इफ इट्स नॉट ब्राइट रेड, इफ इट्स अ बिट ऑफ डार्किश, दैट इट्स एन ओल्ड सैंपल. बट P3 विंडो का परसेंटेज जब बढ़ जाता है, व्हेन इट बिकम्स मोर देन 5%, देन यूजुअली इंडिकेट्स अ डिग्रेडेड ब्लड सैंपल. A P3 window in chromatograms dealing with glycated hemoglobin also indicates one more thing. In diabetic patients, heavily diabetic patients, P3 window can be more than 10% as well. So just keep in mind, suppose आप HbA1c का क्रोमेटोग्राम देख रहे हो, आप P3 देख रहे हो, P3 विंडो 7% या 8% पे है या 10% पे है, बट सैंपल फ्रेश है, तो ये डिग्रेडेड सैंपल नहीं है, सो दैट कंसेप्ट इज रूल्ड आउट. So now just see how much is the HbA1c. Usually you might see the HbA1c of such patients would be 11, 12, 13, heavily diabetic. So उन patients में P3 window थोड़ा high रह सकता है. Come to A0 window, which is adult hemoglobin, retention time around 1.9 to 3. So normally the major adult fraction is more than 95%. So obviously, if any patient, any person who is having a homozygous condition, this adult hemoglobin would be completely replaced by that particular homozyme. So अगर HbS sickle disease है, तो HbA0 के जगह पे HbS रहेगा. बीटा थैलेसीमिया मेजर है, HbA0 कम रहेगा, HbF रहेगा. ठीक है. A2E window, a very interesting and a very confusing window. कॉमन जगह पे एल्यूट होता है, आगे जब मैं क्रोमेटोग्राम दिखाऊंगा तो आपको थोड़ा समझ में आ जाएगा. So normally it is 2 to 3.5%. Beta thalassemia trait is caught in this particular condition. So if A2 is 3.9 to 9%, usually goes in favor of beta thalassemia trait. HbE trait थोड़ा higher side में 3% to 15%, and homozygous is more than 80%. S विंडो में आपका आता है HbS या फिर HbD ईरान. रेट अगर सिकल ट्रेट है तो 20 to 40% रहेगा एस विंडो, डिजीज है तो मोर देन 50%. और सी विंडो में HbC एंड HbE. HbC ट्रेट 30 to 40% अगर ट्रेट एंड डिजीज होगा तो मोर देन 90%. Let's go for some sample chromatograms. Have a look at the chromatogram A out here. तो देखिए, this is a look at this chromatogram. It is look at the A2. सारे पीक नेम्स यहाँ पे है, F है, looks within range. P2 ठीक है, adult भी ठीक है. A2 देखिए, A2 है 5.6%. Normal was around 3.5% तक था, ये 5.6 हो गया. So goes in favor of beta thalassemia trait. Obviously, to come to a conclusion and to make the diagnosis, you need to have a CBC report also with you, because when you are diagnosing certain hemoglobinopathies, it should always be in conjunction with your blood cell indices. वो भी आपको पकड़ना है. You have to consider that as well. Number B, if you can see, look at HbF out here, 29.1%. A2 ठीक ही है. So going in favor of hereditary persistence of fetal hemoglobin. Again, history matters, very important. So two things, a chromatogram, blood indices, and your clinical history. Have a look at the next one. A2E window आपका कॉमन है, ये वाला A2E window. आपका रिटेंशन टाइम मोटा मोटा सेम रहेगा. आपका परसेंटेज देखिए, इट इज अराउंड 24.8%. So goes in favor of HbE trait. And look at this, A2 51.4% out here. And have a look at HbF also. HbF भी बढ़ गया है. So this is a chromatogram of E beta thalassemia. ठीक है. Next one, A2E window में आपका A2 देखिए कितना है, 77.5%, going in favor of homozygous condition. So HbE homozygous, 77.5%. Next is HbS trait. HbS trait दिख रहा है, HbS देखिए 25.9%, एरिया 25.9%, लेस देन 50% है. एस विंडो आपको अलग आ रहा है, 4.42 पे है. So somewhere out here 4.42. ओके. सो यहाँ पे थोड़ा आपको HbF भी बढ़ा हुआ दिखेगा. तो बेसिकली इट्स अ कॉम्पेंसेटरी इंक्रीज बाय द बॉडी. It's trying to produce more fetal hemoglobin in compensation. Then you have HBD Punjab trait. ये देखिए D window out here. D window less than 50%. Retention time अगर आप देखोगे 4.15, और S window का retention time देखोगे 4.42. नियर अबाउट सेम एरिया में आ रहा है, 4.15, 4.42. So HBD Punjab trait, HBD 40.5%. Okay. HBD Punjab homozygous. अभी homozygous में D window is 87.9. So confusion कहाँ पे आएगा? So these are some of the chromatograms with a few examples. You might have seen more cases at your end. Those who are seeing hemoglobin disorders day in and day out. But the challenge which would happen out here is the common eluting windows, that is A to E या HBDS, जिसमें retention time का ज़्यादा difference नहीं है. So how do we deal with such situations? So the answer to such situation is electrophoresis. Okay. So as I told you, HPLC is highly accurate, but it cannot definitively separate variants that co-elute in the same retention. So in that situation, you might have to go for reflex testing. That is, you may have to go for an HB electrophoresis. So if when there's a confusion between HbA2 and HbE trait, then better to go for HB electrophoresis. HbE migrates separately from HbA2 on acid agar, confirming HbE trait. Isolated peak in S window. Again, मैंने बोला था HBS, HBD पंजाब retention type near about same है, co-eluting windows है. So इस situation में आप सिकलिंग टेस्ट या solubility टेस्ट कर सकते हो और एक इलेक्ट्रोफोरेसिस भी कर सकते हो. सॉरी. Same in peak C window. Peak in sin window. If you want to differentiate between HbC and HbE acid. HbE acid is something which I have not seen. HbC, okay. Borderline HbA2, sometimes you might have a normal variation versus a silent beta thalassemia trait. So in that situation, you can go for molecular analysis, that is a PCR or a DNA sequencing, and iron studies. So in that case, it rules out iron deficiency, masking a high HbA2, and it can uncover the silent beta mutation. So I think so that's all I could cover from